A public meeting has heard the Titl District Hospital is losing $20,000 a week as the hospital board announces it has around 3 weeks of operational funds left. Around 250 people attended the public meeting on Monday night to hear from the hospital board. Previous statements from the board had claimed $400,000 of emergency relief funding from the state government was due to run out at the end of March, prompting fears for the community-run private hospital's future. Board Chairman Richard Vickery said that deadline had been extended by 20 days through a combination of adjusting expenditure and an agreement with the Rural Doctors Workforce Agency to subsidize locum costs until mid-June. We on the expenditure side are not doing some things you would normally do as part of normal operations, such as delaying procurement of items or ordering less things, he said. They're very mundane, everyday things that you can't keep doing forever, but you just tighten things right up. The Rural Doctors Workforce Agency will provide payments of around $10,000 per month to the hospital until June 20th to help with the cost of employing locum doctors. Plan after deadline unclear. An online crowdfunding page set up by board member Viola Ellis last week warned the hospital was at risk of having to close its emergency department if it did not receive funding urgently. The closest emergency departments are at Bordertown and Murray Bridge, 47 kilometers and 153 kilometers away respectively. But Mr. Vickery said cuts to services were unlikely to occur in the next 3 weeks despite the facility running on bare bones. To have an emergency department you have to have nurses there 24/7. You need to have a doctor available to you 24/7, he said. Mr. Vickery could not confirm what the hospital's plans were after the 20 days were up. We'll keep reassessing that. It's a fluid situation, so to make any call at this stage isn't appropriate, he said. Technically we don't become insolvent, but morally we do, because we have to preserve an appropriate amount for staff entitlements, we have to keep our refundable aged care bonds separate, and we're quarantining the aged care redevelopment. We aren't prepared to touch any of those funds. No more funding, says Health Minister. The South Australian government allocated $400,000 in emergency relief funding to the hospital at the end of 2018 in addition to the $1 million it provides each year. While the board claimed they were promised a new funding model by the end of March, Health Minister Stephen Wade said that had never been the case. I made it very clear in my communication with Keith Hospital at the end of last year that the $400,000 emergency funding would be the last payment for the rest of this financial year, he said. He said he would not increase the hospital's base funding from $1 million to $1. $5 million, as requested by the board. As I face the challenges in health in South Australia, no other hospital is looking at a 40 or 50% increase in funding next financial year, Mr. Wade said. Community will fight for Hospital. A new action group, headed by the former chair of the hospital board Janet Allen, has been established to help drive fundraising and communication with local residents about the hospital's issues. There's a lot of concern in the community, and I guess a lot of frustration that we're here again raising the issues of the Keith Hospital, Ms. Allen said. The action group will be concerned with local residents. We'll be coming up with ideas to remind people how important this hospital is on the Dukes and Riddick highways. Wakery resident Annette Ball decided to attend the meeting on her way through Keith to show her support for the community. We're people that travel through occasionally, and it's really reassuring to know there's a hospital on this main road, she said. I think it's extremely important. It's a hospital of the community. Contact Lucy Robinson. More stories from South Australia.